We now move to a historic moment, the celebration of the elimination of malaria in Suriname, the first Amazonian country to reach this important goal. To open this part of the program, let us first watch a short video highlighting Suriname's path to malaria elimination.
Our success has been through governments and the dedication and commitment of our health workers and our policymakers.
Everywhere where there is a community, you can train people from the community in doing diagnosis and treatment and report to you.
Próprio esforço do grupo, nós temos pessoas aqui dentro da malária que realmente estão dispostas a fazer o trabalho.
People who are willing to do the work with motivation to work with the community itself. That's what we did to reach our objective.
I would like really these health workers in this area because I experienced the challenge they are facing to reach these places. You can't do that if you are not committed.
I think in the foreseeable future, we can envision a malaria-free Amazon.
We can change the life of many people by reaching this elimination goal.
I have the honor to invite Dr. Sylvain Aldiguieri, Director of the Communicable Diseases Prevention, Control and Elimination Department at the Pan American Health Organization, to deliver his remarks.
Thank you, Dr. Saboya. Honorable Minister of Health of Suriname, Excellency Ambassador of Suriname to the Organization of American States, distinguished delegate from the Malaria Task Force in Suriname, Excellency Secretary General of the Organization of the American States, PAO Director Dr. Barbosa, distinguished delegates, colleagues and friends, I'm really honored to give the introductory remarks in celebration of Suriname being declared free of malaria. Suriname, as our director said, is the first country of the Amazon basin to have successfully eliminated malaria. This is a very important milestone in the history of the fight against malaria in the Americas. Suriname's achievement demonstrates that it is possible to eliminate this disease within the difficult context and ecosystems of the Amazon region, where the affected populations are dispersed, including Amerindian communities, and in the case of Suriname, the Maroon population, and where gold mining has been the main driver of malaria for decades. Around the year 2000, Suriname reported approximately 15,000 cases of malaria per year. During these years, it was the country in the Americas with the highest number of cases relative to its population. Suriname eliminated malaria when it decided to focus its efforts on making diagnostics and treatment available to communities through community health workers and volunteer networks, especially in rural and sylvatic areas. Suriname has now successfully covered the last mile toward malaria elimination, leading the way for the other countries of the Guyanese Shield. Suriname experience is an example of smart decisions, technical knowledge, pragmatism, innovation, and policy continuity. We must recognize the sustained efforts of the Ministry of Health, beginning with Minister Celsius Waterberg, and the actions of experts such as Dr. Stephen Vreden, present here today, and Dr. Martelise Hersel, who we have seen on the video, in the video, who for years have served on the task force that was created specifically to eliminate malaria. We must also acknowledge the work of the medical mission, the Bureau of Public Health, BOG, and all community health workers who have dedicated decades of work under the challenging conditions of the hinterland. Congratulations to the people of Suriname.
Thank you, Dr. Alighieri. Now we are going to recognize Suriname, and it's my honor to invite Dr. Jarbas Barbosa, Director of PAHO, to get together on the stage with Honorable Secretary General of the Organization of American States, Mr. Albert Ramden, and Honorable Dr. Andre Misiakaba, Minister of Health, Welfare and Labor of Suriname, to receive the certificate. Please join us on the stage. It is my honor to give the floor to the Honorable Dr. Andre Misiakaba, Minister of Health, Welfare and Labor of Suriname, for his remarks.
Thank you. All protocol observed. On behalf of the government of Suriname, I wish to express our appreciation to PAHO and WHO for formally acknowledging the elimination of malaria from our territory. This milestone is not only important for Suriname, but also for the Amazon region. While observing the downward trends in malaria transmission, hopes are that in the near future, malaria elimination will be reached across the continent. Supported by several international partners, among which PAHO, WHO, USAID, we have been working for decades on the control of malaria in Suriname. In the year 2002, Suriname had the highest annual parasite index for P. falciparum on the continent. I myself contracted malaria in this period. I almost died. We believe that expanding access to diagnosis and treatment, together with bed net distribution and community involvement, have been crucial in achieving control and eventually elimination of malaria. In the year 2018, due to the steady decline of malaria cases in the country, we became convinced that malaria elimination was feasible. In that same year, a malaria elimination task force was installed with a specific task to guide activities towards elimination. Post-elimination, we do realize, however, that especially with our open natural borders and intense migration, mainly fueled by small-scale gold mining, our status of malaria elimination is still very vulnerable. I will repeat this. Post-elimination, we do realize, however, that especially with our open natural borders and intense migration, mainly fueled by small-scale gold mining, our status of malaria elimination is still very vulnerable. Only when transnational efforts to eliminate malaria from the Amazon region are coordinated, the achievement of Suriname can be sustained. We therefore applaud PAHO's initiative to continuously support the efforts in the region. The Ministry of Health, Welfare and Labor is also aware of PAHO's initiative for the elimination of diseases. This is considered as a powerful action which is welcomed and fully supported by the government and the Ministry of Health, Welfare and Labor in Suriname. Let us celebrate Suriname's achievement today, but also persist in working on improvement of malaria control and ultimately elimination from the whole Amazon region. The government of Suriname herewith expresses its commitment to permanently support these transnational efforts. I thank you very much.